Hi everyone, welcome to a new episode. Today we're going to learn about what are ICD 10CM codes and what are CPT codes. Let's get started. So ICD 10CM codes are nothing but they are diagnosis codes or disease codes. So in the US, every diagnosis or disease needs to be they need to have a code. Okay, that's a standard they follow here. So for all the symptoms and diagnosis, there will be a code. Okay, so earlier it was ICD 9CM, but now it is ICD 10CM. Okay, so after 2015, the latest version is ICD is nothing but International Classification of Diseases. 10 is the 10th version. CM is clinical modification. Okay, so that's the abbreviation. International Classification of Diseases, 10th version, clinical modification. And it is used by all the doctors and other healthcare providers to code all your diagnosis symptoms. Okay, so this is basically in the US, also in Australia and Europe and in UAE. They also follow this ICD 10CM coding. So this is like mostly used throughout, like in most countries. So why are we using ICD 10CM? So what is the necessity? So we have like many diseases, right? So we want to know, we need to know like specifically for what is the, for example, fever. There are like many types of fever. Typhoid fever, fever unknown, like there are like corona fever, like there are a lot of fevers, right? Similarly, for most of the, for example, diabetes. So diabetes, in diabetes you have levels, and then type 1, type 2, and also even if you have depression, right, it's going to be postpartum depression, or if it's going to be clinical depression. There are like many different types of depression. So if you just put depression, right, the insurance is like they may be like, what is this? We need specific diagnosis. So that is why, so this ICD 10CM was created so that like every diagnosis is like with specificity. Okay, and there needs to be a classification. So we are detailing all the diagnosis so that the insurance can understand that what is exactly the patient's condition. So that's the reason ICD 10CM has so many codes. There are like I think it has more than 1 lakh codes, and it's like with a lot of details. So that's the reason ICD 10CM prevails here. So when a patient comes with fever, okay, so patient is going to the emergency room and patient says fever. Okay, and so what happens, doctor just checks the symptoms and then prescribes a medicine, and depending upon the fever, okay, what is the severity, the doctor may give medicines and the patient like goes back. Okay, so in that case, what a doctor, like what he needs to code on that particular chart to submit the claim to the insurance. So he needs to know what is the type of fever. For basic fever, if there are no other conditions, just fever of unknown, then the ICD code is R50. So R50. Okay, this is of unknown origin. Nobody knows, just fever. That is R50. But if it is fever to a different reason, okay, a fever due to so for example, appendicitis. If you have appendicitis, you may develop fever. Or if you have any other abdominal pain, you may develop fever. Or if you have typhoid, that's a different fever, right? So and also dengue is a different fever. So for all those diseases, we have separate codes. But if it's just fever, then the ICD code is R50. Similarly for abdominal pain. So if there is no, like you don't know what is the reason for abdominal pain, then the doctor is going to code R10.0. But if you have reasons, okay, abdominal pain due to food poisoning, or abdominal pain due to appendicitis, or abdominal pain due to a different condition, maybe cancer, it is all like different kinds of abdominal pain, right? So we need to, so the codes will be different for all these conditions. So as a business analyst, you need not know exactly the codes and all that. That's not your job. But you need to know what is ICD 10. what's the purpose of ICD-10 codes, and why doctors are using ICD-10 codes, and why insurance want those codes, because they need to know specifically what is the reason the patient is getting admitted, so that accordingly the charges will differ, right? If it's just only abdominal pain, the charge will be different, or if it's just abdominal pain with appendicitis, then the charge is going to be different. So claims must be submitted with the diagnosis like very specifically for admission. So that is insurance expectation. That's why they expect a proper ICD code. So most hospitals, they hire medical coders. So these coders will be like, they know how to code different patient charts, okay, emergency room, radiology, different pathology, like there are different divisions. So these medical coders will know how to code these. So usually in the US, doctors don't do medical coding. They hire some sort of people or experts who can do the coding for them, and they will be the ones who will be submitting the claims to the insurance. So the doctors will just like treat the patient and do the basic documentation in their computer, and then they will send those medical charts to medical coders, and medical coders will be the one who will be doing this, like what is the ICD code and what is depending upon the doctor's documentation, right? They'll be the one who will be submitting that appropriate code for that particular patient chart. So the next one is CPT code. So CPT is nothing but current procedural terminology. These codes are used for procedure codes. So there is a difference between diagnostic codes and procedure codes. Diagnosis means just like the symptoms and disorders and diseases, okay, like fever, abdominal pain, mental disorders, cancers, all this is diagnosis. Procedure means treatment. Okay, when we say procedure, it means treatment. So in order to code those treatments, there's a separate code called CPT codes. So some of the examples are, for example, a CT scan, okay, comes under a procedure code, and so a CT scan can be done with contrast or without contrast. Contrast means the dye, okay, they may give you a dye or injection before the taking the CT, or we can do without that injection, dye injection also. So depending upon that, the charges will differ. So the codes also will differ, okay. So CT scan is an example. So other examples are X-rays and also lab. Also lab. So in pathology division, right, all the lab tests, like whatever basic lab we are doing, right, for any kind of admission, all that will be covered under pathology codes. Those are also CPT codes. Or any kind of office visits, emergency room visits, all the visits also will be coming under CPT codes. So it's very important that when a claim is being submitted, a proper ICD-10 code and a CPT code is submitted in the claims, because without these codes, the insurance is going to reject your claim and the doctor is not going to get any money for that particular visit, right? So the doctors, while submitting their claims, they need to be very careful. Like every patient chart has a ICD-10 and a CPT code. Only then they'll get billed. I mean, they can get the money. So it's very important. So if in the interview they ask you like what is ICD 10 and what is CPT, are you aware of these terminologies? As a healthcare business analyst, you need to understand that ICD is for diagnosis and CPT is for procedures, and you need to know, as a BA, you need to know these terminologies. Okay, what is HIPAA, what is ICD, what is CPT, why it's being used by insurances for claim processing and all that. So you need not know exactly the codes, but you need to definitely understand what is the terminologies and answer accordingly in the interview. I hope this session is helpful. Thank you for watching.